Hello, everyone. Thanks for coming, and I apologize for the couple-minute delay here. Um, this is the first talk for the Center for Mindfulness Science in about a year or so. It was a little bit impromptu, with not a lot of warning, so I really appreciate you coming, even on the last-minute notice. Um, Dr. Albert Garcia Romeu, who's here with us today, is a researcher at Johns Hopkins, where he's been since 2012. Um, so really very much a part of uh, the growth of this field, the mushrooming of this field, one might say. Unexpected uh, in 2012 when he joined that lab. Academic research was still pretty skeptical and or completely ignorant of the possibility that psychedelics were worth investigating. And this center at Johns Hopkins, where Albert has been, initially headed by Dr. Roland Griffiths, was really instrumental in a very deep way in bringing this research into mainstream academic psychiatry, neuroscience, clinical medicine, the way it is today. Still a lot of questions to answer, of course, but we're very happy to be able to host Albert to tell us a little bit about some of the research he's been involved with over the last 12, 13 years. And I asked him for the special favor, given the emphasis on understanding mindfulness and contemplative sciences that we have here at the Center for Mindfulness Science, to make an effort to integrate some insight into the role of mindfulness in the clinical efficacy of psychedelic therapies. So we'll see how possible that is to do, but I appreciate the effort to do so, and really thank you for coming out and doing this for us today.
Yeah, thank you. Yeah, thanks very much for having me. As Raul was saying, we're interested, since we're here at the USC Center for Mindfulness Science, and I wanted to talk a little bit about some of the places where we've seen overlaps actually in the research between psychedelics and mindfulness, and talk a little bit conceptually about how are these related, and in what ways perhaps they can be complementary. So I wanted to think a little bit about what we know about mindfulness in mental health, because there's obviously been like a pretty robust field of research on that in and of itself over the last, I would probably say 2-3 decades, really, since Kabat-Zinn and others really brought this into the mainstream science of mental health. And then also, how do we kind of conceptualize these two as interacting, psychedelics and mindfulness? In what ways can they be interrelated? And also think about what are some novel opportunities that these might present in the field of mental health care, particularly. That's kind of an area where I work a lot, is trying to deal with various psychiatric conditions, but there's probably more than that that we can do with these tools. I like to just kind of define some of these key terms as we get started. And mindfulness is typically thought of as a sort of approach that brings awareness to one's immediate experience and having a sense of acceptance towards that experience. And so if we can sort of recognize our thoughts and our feelings as in a way as transient and things that we don't get too wrapped up in, there are potentially some benefits to that. But of course, also mindfulness really falls within one sort of area of various different schools and practices, contemplative traditions, different types of meditations. So this is just one area, but I think it's a particularly promising one. And so I'm just trying to think through some of the parallels here. What we've seen in some of the research suggests that mindfulness-based interventions can show promise for treating things like addictions, and also for situations like depression, anxiety, but even conditions like pain have shown some promising data there using mindfulness-based treatments. And then, of course, on the other side of that coin with psychedelics, we've also seen some very similar types of research looking at these interventions for treating addictions, depression, anxiety, and also pain, believe it or not. And so, I think that just in that sense, from a clinical standpoint, there's obviously some real potential overlap and potential for complementarity. But of course, we also have some of the history of these approaches, which I won't go into too much today. I do like to talk and think a lot about that, but we won't focus too much. But there is obviously like a sort of spiritual and traditional component with mindfulness coming out of various Buddhist types of practices and psychedelics, having roots in some indigenous cultures that have used things like ayahuasca, mescaline, and psilocybin for a very long time. So I like to refer a lot to Judd Brewer's work because he, is doing interesting stuff with mindfulness training. And in particular, I've focused a lot of the last decade or so of the work I was doing on tobacco smoking cessation. In terms of public health impact, that as actually the most kind of deleterious substance of all of them. In terms of causing the most morbidity and mortality, we have about 500,000 deaths per year in the U.S., and then that's about 5 million worldwide. And so that actually dwarfs like all the other drugs put together: alcohol, opioids, cocaine, methamphetamine. And of course, people have a very hard time quitting. Best treatments are usually you get about 30% of people to quit, maybe 25, 30. And so this is, just some early pilot work that Judd had done looking at mindfulness training for smoking cessation versus a sort of, psychoeducation type comparator condition. What you can see here, obviously, is that the group that got the mindfulness training got a very, had a pretty robust response that lasted up to about 17 weeks, or roughly 4 months after the treatment, or the quit, I should say. And so you're seeing, rates in that 30 to 40%, which is pretty promising. Obviously, much more so than when you're looking at the control condition. This was actually some of the early work that I joined the lab to kind of help conduct. It was a very small pilot study. At the time, they had enrolled like 3 or 4 people, and they asked me to go ahead and finish this since that was now my job. And so I didn't really know too much. Actually, I was a pretty heavy smoker myself at the time. I eventually did stop. It didn't take too long before I was working with people who were trying to quit, and then I just kind of independently quit on my own. But this study that we did is with Matt Johnson, Roland Griffiths, and colleagues over at Hopkins. We just took 15 tobacco cigarette smokers. They wanted to quit. We gave them CBT for a couple of months, and we also gave them 2 or 3 high doses of psilocybin intermixed in that process. What we found was that about 6 months after the quit day, 80% of those people were quit. And we can verify this biologically using things like urine toxicology and also breath. We kept on in touch with these people, and about 2.5 years later, we called them back to come do some qualitative interviews. But we also got some urinalysis and breath samples, and we could tell that 60% of them were still abstinent about 2.5 years later. So we thought that was very promising. We've since conducted now a larger randomized controlled trial. These results are not yet published, but they're under review right now, so we hope they'll be published like in the fall. But in that study, we had 82 smokers who wanted to quit. They got some CBT in both conditions, and they were randomly assigned to either receive 1 high dose of psilocybin or on a quit day, or to start using nicotine patches on the quit day. This is not double blind or placebo controlled, and the reason is I don't really think you can convincingly do blinding in these studies, because if you use a high dose of psychedelic versus placebo, most people are going to be able to figure that out. About actually 95% of people figure that out pretty quick. Sometimes we use comparators like niacin, diphenhydramine, low doses of psychedelics. Again, they're not very convincing to me. So we did a comparative efficacy study, which I think is better, because this is like clinical practice. You're never going to go to the doctor and be blinded to your treatment. The doctor's going to be like, here's some options. You guys will decide what you're going to take. You're going to know what you're going to take. So that's what happened here. We, of course, didn't give them the choice. But of the people that we followed up so far, I mean, we have all the data, but I can't show them until they're published. But this is just some of the preliminary findings. And you can see, just the 1 dose of psilocybin versus 8 to 10 weeks on the patches. There's a pretty clear separation at 3 months, and that continues to sort of persist through the 6 and 12-month follow-up. And so this 1 dose of psilocybin seems like a pretty robust treatment with some CBT for smoking cessation. And I do think that, again, there's potentially some overlap there with some of the mindfulness type mechanisms. As a sort of side note here, there was some really interesting work that was done by this fellow Eric Kasp at the University of Chicago back in 1964 through 1967. But he took a lot of cancer patients who were dealing with pretty substantial pain related conditions, and he gave them high doses of LSD. And what he found was that these folks were reporting like significant reductions in their pain, which you can see up to about 3 weeks after the drug administration. It's pretty interesting. He had done another study too, where they were also administering other drugs as active comparators, including Dilaudid, which is of course a very strong opioid pain medicine, and showing that LSD worked just as good, if not better, in terms of reducing the pain, which was really fascinating. But what I also think is really fascinating is kind of, if you look at the title of this paper, this is 1967. I don't think Cass was particularly versed in this whole area of mindfulness, but a lot of what he was talking about in this paper, and like the way that he sort of frames how this may work with the LSD, is what he called attenuation of anticipation. And basically what he's saying here in this lengthy excerpt that I copied from the paper is, we are all going to die. We all know that we're going to die, which can create some anxiety, of course. And for these cancer patients or people with terminal illnesses, that's even more pronounced, you might think. And so perhaps something about the LSD experience can kind of help people kind of be more focused on the present moment, kind of similar to a mindfulness type approach, and be less preoccupied with what's going to happen in the future, or to have less anticipation about some of these negative outcomes that they're facing. So I thought it was just really interesting, and that he sort of framed a lot of his work with these very sick patients and was focusing on pain in that way with LSD. Sorry, this thing always looks funny in these when I do these slides, but basically it was in the mid-1950s though when Humphrey Osmond came up with this word psychedelic. People were consistently calling these drugs like psychotomimetics or hallucinogenics because they thought they caused hallucinations or they caused psychosis, at least temporarily. And Osmond, who was self-experimenting but also experimenting with patients, thought that that was not really accurate. And he thought that these drugs helped manifest or uncover latent content that was in the mind. And that's really what the word psychedelic is meant to kind of confer, is that, that's what these drugs are doing. There are things in our minds, they might be kind of obscured by various mental processes, but they can kind of become more conscious through use of some of these substances. And so, when you think of the person in their totality, I often think about kind of these thoughts, emotions, behaviors, and sense of self-identity, as various sort of core features that we kind of are dealing with at different times. And when you're on these drugs, these psychedelics, but also when you're practicing a sort of mindfulness type meditation, often what you're doing is really sort of focusing in on what are these thoughts and emotions. And when you're on these high doses of psychedelics, those thoughts and emotions can become very front and center, and also those processes can become quite altered. That is a short-term effect of the drug. When the drug wears off, and kind of like when you're done meditating, then in theory, your thoughts and emotions and other processes should go back to normal. But what I think is cool is that we can sort of apply these short-term altered states of consciousness where our thoughts and emotions are changed either through drugs or through contemplative practices, to then leverage and potentially do some therapeutic work, which then can help us change behaviors like smoking or other alcohol or substance use, and ultimately actually help people get to a point where they're able to think more about who they are, what is congruent with them and their values and priorities, and their sense of self-identity, and actually change that in a way, or rewrite that script in ways that can be healthier. And so certainly, like for recovery from addiction, I think this is some type of big scale, kind of like large scale mechanisms that may be at play when you're working with these folks. I always like to say a map is not the territory. So, when we're talking about these altered states, it's really hard to sort of get a sense of them if you're not in them. We try to describe them. Other people, you'll see people talking about that. But, it's often said too, the menu is not the meal. So, we're going to try to talk a little bit about some of these altered states, but of course, it's not the same as being in them. And, William James is, one of the sort of godfathers of this area. You know, he talked a lot about these altered states, and specifically after he'd experimented with nitrous oxide in the early 1900s. And he came back and he said, whoa, that was really interesting. And guess what? There's all these other ways that we can sort of think and feel that we can get into these altered states, and perhaps they could be quite useful. And so I think that's informed a lot of the work in this field, this idea that these altered states can be utilized in ways that can help people. Now, one of the problems, one of the reasons why this has been so understudied, I think, is because in the West, we don't really have a very nuanced appreciation of states of consciousness. So we tend to think of things like sleeping, dreaming, wakefulness as these canonical states. Maybe if you're inebriated with alcohol, you're in a rage, you're passionately in love, people can sort of conceptualize that as other states. But it wasn't until like we started getting more familiar with practices like mindfulness and other meditative practices that people started talking more about some of these other states of consciousness, and also using these other conceptualizations from various types of other worldviews. And so this is specifically from a Hindu worldview, but these different concepts started to come into Western mind frame, I would say, more in the middle of the 20th century. And then, of course, you start to also see other psychologists, Western psychologists like Csikszentmihalyi, talking about things like flow states. People like Abe Maslow talking about peak experiences, which he thought may be helpful for self-actualization. And so, I think a lot of these are early conceptions in our Western psychology to try to understand altered states, and also like their potential value, because that's the thing. Often these have been pathologized, hallucinogenic, psychotomimetic. Thinking about these as just, this is bad, you don't want this. But ultimately, it's possible that these types of altered states, like the ones that can be induced by psychedelics or through practices like mindfulness, may actually be very helpful. Specifically, perhaps to destabilize patterns that may be sort of deeply entrenched and quite difficult to otherwise change. So there's some mechanisms I think psychologically and neurobiologically are interesting. And as I said, I do think there's a lot of potential for putting these together in ways that will be useful. I'm going to walk through a little bit of data here just to ground this conversation, and not just some big ideas, but in some actual controlled data that people have collected. We were actually talking about this study on the way in, but this is a great study what was done in a retreat center in the Alps where people who are meditators either during a 5-day meditation retreat got a high dose of psilocybin on, I think it was the first day, or they got placebo. And this is a silent retreat, so people weren't really talking too much about their experience, but this happened in 39 meditators. And in the process of that, what they found was that the group that got the psilocybin as compared to the group that got the placebo were showing some positive mental health impacts, specifically 4 months later, that they found that their mindfulness as measured as a trait had been increased more so than the group that had got the placebo. And then also their psychological and psychosocial functioning was showing greater improvements. Interestingly, there were things that could help sort of predict who's going to respond positively, specifically like openness to experience, which is a personality factor, a sense of optimism, ability to emotionally reappraise things. These actually predicted some of the acute response. But the acute response, and this is something we've seen a lot, and I'll talk more about, meaning the quality of the drug experience when people are under the influence seems to fairly consistently, I would say, predict some of what we see in the long term in terms of positive psychological effects. So we don't know if that's causative, meaning we don't know that you need to have those types of experiences to have good effects later, but it certainly may be a phenomenological marker that if people have these, then the likelihood is that they're more likely to have some of these positive impacts later. And so what you see here is specifically a sense of what they call oceanic boundlessness. It's actually kind of a term stolen from Freud, but the idea is this sense of being sort of, yourself in your body goes away because you sort of become fused with the larger universe. And so this sense of boundlessness and this sense of maybe ego dissolution, if you will, when people are on psilocybin, seen, at least in this study, to predict that later on they would have these positive effects, including just enhanced psychological functioning. There's also changes in the brain. I'll talk a little bit about that. I'm not a neuroscientist, so that's a caveat. But there are often these changes that we're seeing, many of which seem to confer this sort of pattern that's quite interesting. But specifically, these hub regions of the default mode network, as we call it, seem to shift in their connectivity. And those shifts, those changes in connectivity between these areas like the medial prefrontal cortex and the posterior cingulate cortex and so on also seem to be predictive of some of these benefits. So for instance, to the degree to which there was changes in connection between the medial prefrontal cortex and the posterior cingulate cortex, which are these hub regions for attention and self-referential awareness, was also correlated with people's ability to basically engage in mindful awareness afterwards. And so these are the types of brain changes that we think may be induced by some of these very short-term, brief experiences that people are having when they're under the influence of psychedelics. But what's interesting is that you also see very similar types of data when you're now starting to look at mindfulness-based interventions. And so specifically, if you take people who don't practice mindfulness and you start them into a training program where they do start to do that, and then you also take people who are very experienced meditators, and then you're looking at the way that their brains are reacting specifically to emotionally charged stimuli, things like pictures of people being injured or, things that would normally we would find unpleasant perhaps. There's apparently some changes in the way that we experience those and the way that the brain is processing that information that can come about through, some of these engagement and practices like mindfulness. And specifically, in this work from Richie Davidson and some of their group at Madison, they're finding that there was less amygdala reaction to some of these stimuli that they're seeing, these emotional stimuli. So basically, their brain is just less reactive in certain areas, and the amygdala is known as a sort of salience marker to sort of tell you something that you need to be paying attention to. It seems like that signal is sort of dampened somewhat, and then that's also, of course, correlated with certain factors of mindfulness, for instance, as non-reactivity. In this case, is what you're seeing. So these changes can be brought about perhaps through using some of these drugs like psilocybin, but they can also be brought about by a steady practice using strategies such as mindfulness. But interestingly, the amygdala is sort of implicated in a lot of this imaging work that's come out from research with psychedelics. This is a great paper that was done by a group over in Switzerland, specifically just doing something very similar to what we were talking about, but rather than using mindfulness, they were just giving people psilocybin and then showing them these various types of emotional stimuli. And what they found was, again, the right amygdala, when people were on psilocybin, was less active and less reactive to those types of stimuli than when people were on placebo. So, we're starting to zero in on some of the mechanisms in the brain. And, some of this seems to be around emotional response. And, what's quite interesting too, this is another study that was done at Imperial College in London with patients with depression who got psilocybin. And what they found was that there was change in the amygdala blood flow after the psilocybin, and the degree to which there was change in, I should say, reduction in the amygdala blood flow, there's also improvements post hoc in their depressive symptoms. And so there, again, there's something happening, biologically that seems to at least give us a hint of what's, leading to some of these the antidepressant or other types of beneficial mental health effects. Another interesting line of work has really been looking at just how is trait mindfulness, so basically one's ability to be mindful, to be aware of what's going on in the moment, is impacted by psychedelics. And so there's been a number of papers kind of like this where people basically are given a drug like psilocybin, or in this case ayahuasca, and then before and after they're sort of tested on some of these traits, like how mindful are they, what their cognitive flexibility looks like, and so forth. And what they found specifically was that, the day after an ayahuasca journey, you're seeing significantly increased, mindfulness type qualities as well as cognitive flexibility. Now, this is pretty short term, but this is just after the drug has been administered. But you've also seen this in some of these other studies that have been done specifically by groups down south and working with ayahuasca, particularly in this case with ayahuasca, seeing that these people who got just one dose of ayahuasca were more mindful up to 2 months after the fact, and specifically are more non-judgmental. And so if we have a sort of knee-jerk or instinctive reaction to judge things, perhaps as good or bad, positive or negative, again, these are actually really important concepts in various schools of mindfulness and Buddhism. But this idea of being non-judgmental of one's experience seems to be something that could be facilitated by some of these experiences with the drug. And again, there's also correlated brain changes. In this case, changes in functional connectivity between the anterior cingulate cortex and the medial temporal lobe. But regardless, this is, again, starting to point to some of the ways that information processing and emotional regulation is sort of changing after these drugs. And, specifically this mindfulness type capacity seems to be increased. Now, this is from another small study that was done in Denmark, published a couple years ago. These guys are doing some really interesting work out there, but small study, a PET study though, with psilocybin. And what they found was that after one dose of psilocybin, these healthy adults were showing significantly increased personality openness and mindfulness. And that's something that they're able to measure out to 3 months after the one drug dose. And interestingly, again, as we kind of try to dig into the biology of this, there seems to be some change in the serotonin 2A receptor binding that is predicting some of these effects. So we know that serotonin 2A, is a prime player in a lot of this stuff, but it's still something that we're trying to work out in terms of what the directionality of that is. This is a really interesting study that was done at Yale. It's a cool study because it's a fixed ordered single-blind placebo-controlled study. What that means basically is that the researchers knew that everybody in this study had depression and that they would first get a placebo where they would lay on a couch for 6 hours and listen to music, and then they would later get psilocybin and they would lay on a couch for 6 hours and listen to music. And so they knew that that was going to happen. They also told the participants, hey, you're in a study where you might get placebo, you might get psilocybin. So they didn't really know what the order was going to be or what was going to happen. They also took EEG and various measures, and there was some supportive therapy throughout the process. Now, here's what they found, which is pretty cool. With this is a small study, but still, what they found was that here, after the placebo session, there's like a little, you can see bump of improvement in their depression scores. And so that is where they're at from the gray bar into the green bars. Then that last gray bar there in the middle is right before they get their psilocybin dose. And then that red arrow is where they get psilocybin dose. And then you see this other drop, which goes quite a bit further down in terms of their depression severity, indicating that, yes, some of this is a placebo response, but perhaps some of this is related to the drug itself. And I think that in itself is already quite telling. But now we start to dig into the biology again. And what they did was they were taking EEG before, 1 day after, and then 2 weeks after each of the sessions. So there was a placebo session and a psilocybin session. What they found was that the brain didn't change pretty much at all in any noticeable way the day after placebo, nor did it change in terms of the electrical activity. This is using EEG at 2 weeks later. And then the day after psilocybin, the brain is still more or less doing the same thing. There's no big changes. But 2 weeks later, randomly, they're seeing this change. Specifically, there's this significant increase in theta activity. So that's what they measured 2 weeks after psilocybin, not 2 weeks after placebo. Okay. Well, when you actually go back and start to look at the correlations, you actually see that to the degree that there was increase in theta power in the brain 2 weeks after the drug, by the way, you're also seeing those improvements in depression scores. So there's some activity it seems to be kicked off during this drug experience, but it continues to persist, for several weeks out. And again, it seems to be leading to some of these mental health benefits. In this case, antidepressant effects. From the same study, though, also quite interesting if you look at the psychological mediators of this type of antidepressant effect. And specifically, what they found here was that after placebo, you're not seeing any improvement or any changes in people's psychological flexibility, makes sense, nor their mindfulness. However, after the psilocybin, there is a significant improvement in both their psychological flexibility and in their mindfulness. So this is something that, again, the drug seems to do, is to help people be more mindful somehow. How exactly, we don't know. And again, these types of effects, this specifically this improvement of psychological flexibility and this increased mindfulness, is leading into, or at least correlating with, the antidepressant benefits later. So, there's just been a ton of work, though, looking at, or not, I shouldn't say there's been a ton, but there's been a ton more work, because there was no work happening basically between 1970 and 1996, roughly. But, since the 2000s, we're starting to see more and more of these papers. And really, what they're indicating to us is whatever these types of drugs, these serotonin 2A agonists specifically, are doing, it seems to be massively reorganizing the information processing in the brain in ways that other drugs don't. And so this is a great prime example where people either got psilocybin or methylphenidate. Methylphenidate is a ADHD medicine, and they're getting in the scanner every day for, I think, 21 days. So there's what they call this deep sampling. It's a small study, just a few people, but because you can only get a few people to do this kind of thing in the scanner over and over, it's quite tedious. But regardless, they're seeing, again, what you can kind of infer from these heat maps is that the brain's functional connectivity is changing all over, from before to 3 weeks after psilocybin during that time course, whereas you see very few and minimal changes from the methylphenidate. You can see sort of those gray areas are where there's really nothing that's different. Whereas, you can see on the cortex of the psilocybin figure that there's quite a lot of this reorganization going on. And this is, again, that's something that's happening up to 21 days after people got the drug. So we don't really understand why any of this is happening, but we're starting to take a look at the serotonin and glutamate systems, and also how this is impacting neurotrophic factors. And I'll talk more about that. And of course, there's also these really interesting psychological effects that I've alluded to. One cool study that was done by Katrin Preller, who's over in Switzerland, basically just gave people music that they found sort of meaningless, or this didn't mean anything special to them. It wasn't like a particularly favorite song or anything. And they had people listen to it under the influence of LSD and also when they were on placebo. And what they found was that when they're on LSD, they tended to find things more meaningful, things that they would normally under placebo find neutral, if you will. And there seems to be some sort of quality of meaningfulness that really can come through these sessions. This is a scale you can see on the right there, personal meaning, and it goes from 2 to, I actually think a 7 is a high score there. But the score would basically be the most meaningful, one of the most meaningful experiences of my life, versus closer to the 1 or 0 is not meaningful at all. And this is in the cigarette smokers that we were working with in the psilocybin study. So we asked them after their experiences, how meaningful was that to them? You can see it's sort of clustered mostly, on the right side, but to the degree that it was meaningful to them, 6 months later, it was correlated with their change in their confidence to abstain from smoking. So the more meaningful these experiences are, and also the more of these unitive qualities, which we typically call this mystical type effect, that really seems to come through as a sort of marker that later correlates with some of these positive changes. In this case, with the unitive or mystical type experience, predicting reductions in craving to smoke afterwards. And this has been seen sort of again and again. Now, it's not consistent in all the studies, but many of the studies have seen that the more unitive type effects that people have, or this oceanic boundlessness that they've experienced when they're on the drug, the greater improvements they're seeing later in things like anxiety or depression, in this case, in cancer patients. Or in this case, this is actually the largest study published with psilocybin ever, 233 patients that was done by Compass Pathways to treat people with treatment-resistant depression, 1 high dose of the drug, or 1 very low dose of the drug, or 1 medium dose. They found that the very high dose was the one that was effective, not the other 2. But they found again here that to the degree that they had this sort of oceanic boundlessness or what they call this emotional breakthrough, which is another factor, you're seeing this improvement in depression later. And, this is just something that we see not just in clinical trials. I mean, this is a study I did with a graduate student, CJ Healy, who basically asked people about going to raves and using these types of drugs, or going to various types of retreats, spiritual retreats. And again, what we found is in these people, these were people with a history of childhood maltreatment and trauma, that their sense of emotional breakthrough and oceanic boundlessness during the drug effects were correlated with their improvements in terms of their trauma and their emotional distress. Interestingly, we even see this type of thing happening with ketamine, which is not what we would consider a classic psychedelic like psilocybin. But, again, the more the unitive experience that people have, the greater their improvements, in this case, in cocaine use. And this was in a sample of people who were 55 cocaine-dependent individuals who either got an IV infusion of ketamine or midazolam, which is a benzodiazepine, as a control. What they found, though, was about 50% of the group 2 weeks after the infusion were not using cocaine anymore, which is a really high number. If you know anything about treating cocaine use disorder, is very difficult. And as comparison, you can see only 11% were abstinent in the control group. Just to go back one slide, this is what they could find that predicted that, which is this experience of unity or mystical type experience during the infusion. This has also been seen in depression studies with ketamine, which I'm showing here. But this sense of unity, spirituality, and insight, for whatever reason, is often predictive of these benefits down the line. And going back to these smokers, when we asked them to sort of describe their experience, these altered states, and what was memorable to them, none of these people ever met. None of them ever talked to one another. They had all come to quit smoking, not to necessarily have any sort of big experience spiritually. Nevertheless, you start to see these patterns in the data, in their accounts of these experiences. People will say things like, "We are all one," "The awareness that all is one," "Oneness with the universe," "My body melting and becoming one with the universe." We weren't telling people to say this, obviously. We were just asking them what was most memorable, and these are the things that they say. I have kind of posited that I think perhaps this is something like a trauma inverted, if you will. And, often people can conceptualize this in biomedical sciences pretty easily, which is you can have a really bad traumatic event on one day, and that's going to have negative repercussions on a person's mental health, perhaps for the rest of their lives. But we have a really hard time conceptualizing that the other way around in psychology and medicine. However, what it seems to me is that when we give people these psychedelics and they have these types of unitive experiences, they tend to sometimes have these persisting benefits, almost like it's this inverted trauma. So I'm going to talk a little more about the brain stuff briefly just before we wrap up, because this is another kind of hot topic that's come through. This is actually one of the early studies looking at this in 2013, where they're finding that when they gave these mice psilocybin, it was helping them extinguish their fear response, which is pretty cool because it meant basically they were unlearning this fear response they were having from being randomly shocked. And this is kind of similar to being treated for PTSD. It was seeming to facilitate that process. But what they kind of found on the side here was that it looked like there was birth of, or neurogenesis, new brain cells, specifically in the hippocampus after the psilocybin was administered. And this is just one dose of the drug. And so that was curious, but now is something that's actually become pretty well established by people like David Olson and others, and who have even started to talk about these drugs as neuroplastogens or psychoplastogens. And the idea being specifically that when you administer one dose of these drugs, it's actually having this persisting structural changes that are coming along with it, specifically that there are these new connections that are forming between the neurons. So that could be new synapses, new projections like dendrites. And so as these new connections form, then it may be helping perhaps facilitate learning, which indeed we're seeing. This is work from Alex Kwan, who's actually also done a lot of the really fascinating research in the field here with animals. and showing that specifically you're seeing these new spines grow off of the neurons up to a month after one dose of psilocybin. And that's also correlated with things like reductions in learned helplessness. So these changes in behavior, basically, that if we were thinking about humans, we would think are probably pretty favorable. This is another paper, it just came out, but I love it because you can actually see, up to 65 days after one administration of psilocybin, that there's this significant increase in spine density that you just don't see in the group that gets placebo. This is mice. But you can even look at, to this level of resolution, where these new spines are kind of growing off of the neurons, and typically in places that you want new spines, specifically something like the prefrontal cortex, which is involved in like planning, decision making, and so on. Other neuroscientists like Gould Dolan have done some really interesting work as well, looking at what they call these critical periods. Briefly, as rodents go through their lifespan, there's a time when they want to be around other rodents like themselves. Typically when they're young, they like to play, they want to be around each other. Then that they want to continue to do that when they're, in adolescence and in the time when they're young adults, so that they can basically mate and, procreate. But then after that, they typically, over time, want to be increasingly isolated and spend less time with other rodents. And what's interesting is that when you give these rodents psychedelics, then all of a sudden they start acting young again, meaning they want to be around each other more. Curiously, the longer the drug exerts its effects, specifically drugs like LSD, for instance, can last like 10 to 12 hours, versus psilocybin is more like 4 to 6 hours. The length of time that people have these drug experiences correlates with the length of time after which you're seeing these changes in this critical period, or this basically this openness to behaving the way that they used to when they were younger. So what this means, again, we're not really sure, but it seems like this could be another mechanism that's really shifted by these drugs. One last thing I'll say, which I think is really important too, is that it's not just the drug, and there's often in these studies some sort of therapy involved. In this study specifically, which I helped out with, there was not a therapy, but there's actually like a meditation, instructed. And so people learned how to meditate in this study, and they're, instructed to continue doing this meditation throughout the process. And then they were split into 3 groups who either got 1 milligram of psilocybin, 1 high dose of psilocybin, or a high dose of psilocybin, but with a support group, kind of like what you'd consider a Sangha from the Buddhist standpoint, but basically a group that would come around once a week and talk to each other about their psychedelic experiences, about their meditation practices, and so on. So what they found in that study really was that the people who got the high dose of psilocybin got more mental health benefits after they started their meditation practice than the people who got the very low placebo-like dose. But what they also found is that the social context is really important and meaningful in mediating some of these changes, and specifically in things like meaning in life or forgiveness. The people who not just got the high dose of the drug, but also had the support groups to talk about their experiences, were the ones who had the most significant benefits. And so ultimately, there's a lot of different factors that are coming in here, that it's not just the drug or the intervention, but I think that there's also this sort of social set and setting piece that we need to think about. Similarly, when we're talking about, some of these practices, it's good to have some cultural humility as well, just because, many of these have been used outside of the Western sciences for a long, long time, particularly in indigenous cultures. So pretty much, wanted to wrap up by saying, there's a long history of psychedelic use, long history of these meditative practices, but they're still relatively new to Western science and psychology. And so we're still trying to understand how they work, how we can use them. I think they actually can be very, in facilitating a lot of some, these benefits that we're looking at, in terms of treating things like addiction, anxiety, and depression, and perhaps even pain. And I think that there's a lot to, that we may be able to do by combining them in therapeutic approaches, using both, psychedelics and mindfulness or other types of meditative practices. So I'll stop there, leave a few minutes for some questions. And just want to say thanks, obviously, to the research funders who have helped made this work possible, as well as our research participants. Thanks to you all for your attention. And, if we have any questions that we don't get to, my email is up there, so feel free to reach out. And I'll go ahead and open the floor. So.
I'm going to help out with the online questions. I'll just take this so
Cool.
I can be heard as well.
Great.
Like that. In the room and ask questions.
Hi, I'm Jay Wong. I'm an archaeologist, and so I'm thinking about this. People have been, non-Western people in the Americas have been using these substances, and we examine them as, for instance, there's a site in the Central Highlands of Peru where they a culture of Indo Contar, where they use psychedelics heavily.
Mm-hmm.
And the archaeologists in charge of the site talk about it as a mind alter, like a mind control program. That's how they're thinking of it.
Mm-hmm.
But I'm looking at this and I'm thinking more spa, like more people coming, because this cultural phenomenon spread throughout the Andes at about 200 BC, a little earlier, and it's. Yeah, but anyway, so I'm also a healer practitioner, and I practice shamanic journeying without psychedelics.
Mm-hmm.
One of the things I find most interesting about your talk is that it seems like the implied conclusion could be that mindfulness, psilocybin, LSD, other substances, are all basically doing the same thing. In other words, they're altering our state of consciousness
Mm-hmm.
in a way that supports the realignment of our neurons, such that we then result in more pro-social behavior, in more mindfulness, in more feeling of oneness with everyone else. And I have been a proponent, because I access an altered state of consciousness through a repetitive drum beat.
Mm-hmm.
And I find it much more utilitarian. I don't need 12 hours. And just listen, put some headphones on, dim the lights, 10 minutes, and I have an answer to my question. So I'm wondering if, because you seem to be a big fan of psilocybin, or you're studying psilocybin.
Mm-hmm.
I presume you've used some yourself. Although maybe not. And I wonder if of course there are subtle differences, but I wonder if you feel that fundamentally at the base of it, that it's the same thing.
Yeah, so great question. And I think, what the question is really kind of around whether practices like mindfulness or shamanic journeying, for instance, using things like repetitive drumming or other types of music or chanting, or even, psychedelics may all be kind of doing the same thing. I think they're probably working on similar processes, and specifically perhaps shutting down some what you might think of as overactive processes that might be happening, particularly like as we go through life, things that we learn and pick up, some of which may be more maladaptive. It can kind of maybe reset a little bit the way that our brain is functioning. And so, yes, I do think there is some overlap in terms of what these things are doing. And yeah, ultimately, a lot of that can be sort of under this rubric of altering consciousness, altered states of consciousness. By entering these, we're kind of getting out of our fixed sort of rigid patterns, and perhaps kind of giving us a little bit more leeway then to, act in ways that are congruent with, what we think are optimal, and in that case, something like more pro-social behaviors and such, or healthier behaviors. So,
yeah. So mindfulness is sort of a long-term technique that you learn, as opposed to psilocybin is a flash change of your neurochemistry.
It seems something like that, yeah. Because with mindfulness, usually it will be a practice like going to the gym where you do it over and over. So you don't just go once and then you're ripped. like you would kind of keep going over and over and over. And then over time, you develop those muscles and those skills. And so I think you do that with mindfulness and probably with journeying as well. I think, shamanic journeying of that sort, because you can also kind of get yourself more comfortable with getting induced in this altered state, which can take some practice. But the drug is a little more of a sledgehammer because it just directly hits the neurochemistry. For many people, it can kind of get them there quickly. But yeah, in terms of whether or not that's going to have the lasting benefits, I think that's one of the questions is, how do we facilitate that? And I think by using some of these other practices to bring people back to that, is really helpful.
Thank you.
Yeah, thank you.
Thank you very much. Wonderful presentation. I have a couple of questions from the audience online. Just want to pass by you. The first one seems like a very valid, kind of clinically oriented question. Could psychedelics backfire for highly sensitive and highly receptive individuals? For example, taking psychedelics to reduce overall heightened receptivity. For example, how would that look for someone with autism who has the rest of this, who already has sensory reactivities or heightened sensitivities that are getting problematic for them?
So that's a great question, and the definite answer is we know that there are certain people for whom these types of experiences and substances can be difficult and problematic, and that's actually true. Willoughby Britton, who's at Brown, has done some really cool work looking at people who go on meditation retreats and have these really pronounced psychiatric and psychological challenges during and afterwards. And the way that I tend to think of it is that for some people we can become over rigid. And then these drugs can, and practice can introduce some noise into the system, which can then help us sort of, become less rigid and perhaps kind of change, more flexible and change those patterns. But there are other people who are perhaps not as rigid or stable in terms of their mind frame. And in those cases, there's a real possibility that these drugs will destabilize them to a point where they can have some really difficult issues, things like inducing psychosis, delusions, and we've seen that in multiple case reports where people, take a drug like psilocybin or ayahuasca and then, end up having some of these difficulties afterwards. So yes, now to the specific question around autism, that's not something that I think has been well studied. There's, I think, a fellow named Gary Fisher who worked a little bit with LSD and people with autism back in the late 60s, but we don't have a huge pool of clinical data to draw from. There is a fellow who's written a book about being autistic and using psychedelics. I forget the name of the book, but how he found it for him helpful in order of conceptualizing other people's mental and emotional lives more so. And my friend Alicia Danforth, actually, who was here at UCLA at that time, did a pretty cool study using MDMA, particularly with people who had some autism spectrum disorder and also some social anxiety, and found that the MDMA therapy seemed to help them be less socially anxious. So I think there's possibly some ability to use these drugs in some folks with like autism type conditions, but yeah, in the specifics of that, we have not well studied yet. And yes, absolutely, we know that for some people these drugs can backfire or lead to like negative effects.
There's one more question from online, but before I mention it, anyone else in the room?
Yeah, I have a question about just the paired mindfulness and psychedelics leading to kind of openness and kind of obviously increased mindfulness. This is, as someone who's kind of working in this field and who's really interested in this stuff, I kind of feel like I've observed a sentiment within the psychedelic world, professional and kind of like, within that world of like, psychedelics are here to save the world. And everyone needs to do psychedelics, and then they're going to be more open and mindful and loving, all these things. And I'm curious if there's any research, and this could be a Google search, but I'm curious if you are aware of any research that has looked into stuff about potentially like stereotyping cognitive heuristics and prejudice and general kind of like, if people have looked at psilocybin or any psychedelics as, I think it makes intuitive sense that increased openness and mindfulness might lead to less kind of racist or prejudiced beliefs, just in my mind. And I'm curious if someone has looked at that connection in populations, I don't know, yeah.
So, yeah, I think, the question of, and yes, you're right, I think there's been this really huge overblown sort of hype around these drugs are going to save the world and all that. Obviously, that's not the case. I think they may be useful tools to sort of help us as we move forward, into this very chaotic era that we're in with all of these new developments in technology, geopolitics, environmental challenges that we're struggling with. But, in terms of, what do we know about how these drugs can influence people in terms of their thinking and whether they become, for instance, more prejudiced or not, or, what kind of cognitive biases they might have or be able to shed, as a result of using these. We don't know too much. I think there was one little study that Robin Carhart Harris did looking at like political beliefs and endorsements, finding that I think people who, after their psychedelics, tended to kind of endorse more sort of liberal types of views, but this is really small preliminary work. I think the closest that we've seen is there's been people like Sam Gandhi and others who are doing this research around environmental like attitudes and beliefs and behaviors. And from the philosophical side, my buddy Sandeep Nayak and others have been like looking at more the degree to which we see other things as living or conscious. And, this sort of view of panpsychism, as we would call it, in the philosophy of mind. And the idea seems to be that they think that perhaps these psychedelics will make people more prone to having these pro-environmental beliefs, and also perhaps that they might also lead us to think or see other creatures like bugs or plants, as conscious, and therefore maybe, behave in ways that are congruent with that, like not stepping on them. So, I think that's really interesting stuff. But I'll just say, if you look at people like the QAnon shaman who, was one of the guys who, raided the Capitol on January 6th, and, the guy with the horns and all that. I mean, that's a big psychedelic enthusiast right there. And so, and if you, I don't know if you guys have watched some of these interesting kind of documentaries on cults, which there are a couple of them on Netflix. But man, some of those folks are like, talking about how like Trump is the next coming of Jesus and he's a savior, and they have all these crazy delusional beliefs like that are very far out there, and they're also like heavily using psychedelics. So I definitely don't think necessarily this is going to like lead everyone into some sort of necessarily more enlightened mental space. Unfortunately, I do think that there's some sort of where you start as your baseline. And also, as I mentioned, the sort of influences that are around you can really sort of shape what ends up happening after people get into these hyper flexible states, right? So.
Do you ever see any patterns in religiosity, like people's religious or supernatural or spiritual beliefs change maybe in like either theistic or atheistic directions?
We're trying to study that more. We did a little study with a few hundred people, like before and after psilocybin use. And what's really interesting is that did not change at all, But I should say from personal experience, I've had experiences where I'd say we started off as much more agnostic before, particular experiences I've had that were of this ilk. And afterwards being very convinced that I had been in direct contact with higher powers than anything, that we deal with on a daily basis. And so, I can see both sides, but just from some of the empirical data that we have, we don't see a ton of that. But yeah, I think it's, we have such limited information on the stuff that you guys are asking about. So it would be good to gather more of that information. And I would say too, we were saying before, like the baseline where people start, that is something that really will influence whether or not someone's going to even take one of these drugs. So maybe the people who are more pro-environmental or more liberal or more religious or spiritual in the first place might be the ones who are more prone to going out and using something like this. So that also kind of confounds a lot.
Thank you.
Mm-hmm.
I'll bring up two last questions from the online crowd, and also kind of a final comment of relating, the work that we're doing here to the work you're talking about. For those who don't know, my lab here at the Brain and Creative Institute, we're running a study looking at systematically comparing the effects on brain behavior, long-term psychological change associated with psilocybin-assisted therapy on its own, to that same form of psilocybin-assisted therapy in the context of an 8-week kind of customized mindfulness and meditation training program, kind of midway through between classes 5 and 6. So very interested in this question about the potential complementarity of these two very different modalities that do have some things in common. Related to the questions of the basic effects, two questions. One, which we're going to be looking at in my study, and I'm not aware of others who've looked at this yet, so I'm curious if you are. Has there been any research on whether psychedelics increase interoceptive abilities? And then the second question is kind of related, you can kind of answer together, is just how long in general do the quote-unquote mind-expanding effects of psychedelics last, and does one need to continue to use to have continued benefits?
Great. So those two questions. Let's see. I'll start with the first one. In terms of specifically looking at interoception, I don't know that anybody's really looked at it. Probably the closest that I'm aware of is a group in New England who had done a study of psilocybin and body dysmorphia, and found that people were more, or that they had less body dysmorphia after going through a psilocybin treatment. And so I would suspect that some of that may be mediated by some changes in interoceptive awareness. Interoception being kind of like our sixth sense, really, of where our body is in space, which can be highly altered under many of these drugs, but can be also very scrambled for people with things like body dysmorphia, who see themselves as very much too big or much too small. And so those are the folks that we've seen have shown improvements. One thing that we're looking at with smokers, which is kind of similar but less body awareness and more emotional awareness, was that this group that I work with in Baltimore, they found that smokers who were highly alexithymic were the ones who had a harder time quitting, and alexithymia being basically unawareness or inability to be aware of one's emotional state. And so the ones who had a harder time saying this is how I'm feeling, are the ones who had a harder time quitting smoking. And so we're looking at whether or not alexithymia changes, but we haven't seen anything quite yet with that after psychedelics. But yeah, I think interoception is a really interesting one, and one that has not been well studied. In terms of the other question, how long do these effects last? It's really an open question. I mean, and it really depends, I think, because if you're talking about healthy people versus people with organic major depression, where their brain is basically prone to having these episodic chronic episodes of depressive symptoms, versus somebody who has obsessive compulsive disorder or something else, I think we're going to see sort of various profiles of how people respond to these. But it does look like, from much of the data, that at least a lot of these benefits will last a couple of months for people, particularly with the structured support from a therapeutic setting. And for some people, I mean, if you look, Gabby Ajan-Leib, who is at working with the NYU group, got these cancer patients 3 or 4 years after their psilocybin experience and asked them about their depression and anxiety, the ones who were still surviving at that point. And many of them were still reporting improvements in their depression and anxiety, measurable improvements, 4 years later. So, and that was from one dose. Now it's unclear, maybe they went out and used more. But yeah, it's very feasible, it seems, that for some people these will have some longer lasting effects, and for others maybe not, and they may need to go back and do this on a more regular basis, every 6 to 12 months, or perhaps this is just not the right modality for them. So yeah, but that also is still an open question. A lot we don't know. So
I have a thought on the interoception question, because I'm thinking about how high dose psychedelic experiences, the boundary between yourself and the world kind of dissolves. So it might be difficult to measure interoception if it's kind of non-existent. And then my second question is about like how psychedelics reopen critical learning periods, because I listened to a podcast that hosted a scientist who worked on that, and she was saying that there's hope that psychedelics may reopen the motor learning critical period,
Yeah.
and so it might help stroke patients regain mobility. And so that made me think that maybe because of that and psychedelics neurogenesis effects, psychedelics may be helpful in reversing or slowing down neurodegenerative disorders. And I was wondering if you had any thoughts on that.
So we're just starting to look at all that stuff now. So Ghoul is working on that study with stroke patients to see if indeed, they can be rehabilitated more quickly after, psilocybin or psychedelic administration. Because of some of what you're saying, perhaps it reopens this ability to learn like when you were younger. And some of these folks who've had these brain injuries, there's also been work with traumatic brain injuries patients, mostly combat veterans, using ibogaine and showing that they had these significant improvements, not just in their neuropsychiatric symptoms like anxiety and depression, but also in their like working memory and stuff like that. So it does seem as though there is a real possibility there. I'm doing a small study in patients with Alzheimer's disease with psilocybin now, so we're trying to see what the impact is going to be there in terms of their mood and cognitive function, but that's still work in progress. But even in a small study that was published from San Francisco just a couple of months ago, they found that patients with Parkinson's disease, which is a neurodegenerative disorder of sorts, that those people were experiencing improvements in their mood after psilocybin, which makes sense. It's congruent with all these other data, but then their motor symptoms. And so that does kind of suggest that not only are they feeling better, but I mean, something is happening in here that may potentially be related to actual improvements biologically, that lead to some of these motor symptoms and other problems. So yes, people are real interested in that and trying to figure out how we can study it safely and how we may be able to apply it.
Thank you. I have one more question, actually. I know that most of the research and also like the big results with psychedelics has looked at like high doses, but I'm wondering if microdosing could be helpful for people who like have disorders like anxiety, depression, that like are correlated with the hyperactive default mode network. I'm just thinking that maybe like just a little bit of psychedelics could deactivate it just enough so that you're still fully functional, but it's not hyperactive anymore.
Yeah, so that's another really good question. I don't usually talk about microdosing, in part because we have such limited data available, and I'm also highly skeptical of it. But the limited clinical data that we have, like from randomized controlled trials, have not really shown like what you would consider mental health benefits. So there was one small study in people with ADHD, they were microdosing LSD. The people who got placebo actually had more improvements than the people who got the microdoses. But most of these studies, usually we just use like one or a couple of doses. And so there's not this chronicity of dosing that you would have in a regular microdosing practice. So we can't really infer that much from those data where, like in Guy Goodwin's big study with psilocybin, people got 1 milligram or 25 milligrams psilocybin. The people who got like significantly better from their depression were the 25 milligrams. But maybe if the people who in the 1 milligram group kept taking that, maybe over time they would show some improvements. So we just don't know because many people haven't done those types of studies. But we're doing one. Some colleagues are doing some in Canada. Some other folks are doing some in like Australia. So we'll learn more soon. And I do agree with you, though, that there's possibly some utility of that approach, which is much more congruent with like SSRI treatment. You're basically like on a very mild level trying to modulate the serotonin signaling in the brain. The only problem that I'll just say briefly is that because we know that a lot of these drugs also are agonists at the serotonin 2B receptor, we know that drugs that do that, if you take them over and over again, they cause what we call valvulopathy or heart valve problems that can actually be fatal. And so some drugs, like specifically fen-phen is a good example, which was used for weight loss back in, I think, the 80s. But they had to pull it off the market because they figured out, oh, this is like actually causing people to develop these severe heart problems. And so there's a potential risk that at least some of these psychedelics could do something like that if people continue to take them long term that way. So anyways, a lot of questions we don't know the answers to, but it's possible that we could use microdosing type protocols for certain conditions, and that could potentially be useful. Most of the data that show that these are therapeutic, though, tend to use very high doses just at once or a couple of times. Mm-hmm.
In your study of Alzheimer's disease, what stage of Alzheimer's disease are you?
We're starting very early. So when they're just kind of getting the diagnosis, when they're just having kind of mild cognitive impairment-like symptoms. So if they're having like much more pronounced, severe memory loss or other problems, then typically we would not, have those folks in the study. And we'd be afraid actually that would be exacerbating potentially.
And the part of the posterior cingulate cortex and anterior cingulate sense of self it deteriorates in Alzheimer's disease. So I fear that psilocybin would amplify that.
Yeah, potentially. Well, thank you very much.
Thank you.